certainly can echo what Lisa was saying earlier, as far as seeing an increase in calls for youth and young adults in crisis from our Children's Mobile Response Program in Bergen County. We saw record numbers, probably starting around fall, spring 2020 leading into 2021. And I think some of that is weighing the fear of, when some of the fears of the contagion, when vaccinations became more available, our calls for mental health crises increased. And I think homes kind of served as a pressure cooker for families who were stuck there together for school and work. And for LGBTQ youth in particular, when there's a low level of family acceptance, a low level of community acceptance, messages of shaming, not recognizing one's chosen pronouns, identity, name, that greatly increases the risk for suicidality. And we see disparities between LGBTQ plus youth and cisgender heterosexual youth when it comes to those factors. The Trevor Project, which is a nonprofit that's been around for several years, I believe we have a link to their National Mental Health Survey in the chat. They surveyed 40,000 youth and young adults ages 13 to 24 in 2021 and found that 42% of LGBTQ youth seriously considered attempting suicide in the past year, which is just staggering. And if we narrow it down to just non-gender, non-conforming youth, those numbers increased to over 50%. And sadly, the rates were actually higher for 13 to 17-year-olds compared to the 18 to 24-year-olds. And that may be lack of agency, again, lack of family acceptance in the school and in the community. We know that recent politics negatively affected youth when the communities are not accepting, when folks can't have their legal documents match up with their chosen name or identity, or can't even use their bathroom and have their basic needs, medical needs and mental health care, affirming their identity, then that's sending a message that you're not wanted, and there's higher levels of discrimination and threats of violence amongst these youth. Into adulthood, unfortunately, the problem does persist. Findings show that LGBT adults ages 18 to 25 were 4 times more likely than straight young adults to report planning and attempting their suicide in the previous year. So, we really have to look at medical and mental health care that will address these needs specifically, because suicide itself is a pandemic. It's the second leading cause of death of all young adults, but the rates are much higher amongst these young adults who are also more highly impacted by COVID-19 with loss of job, barriers to shelter, homeless prevention and intervention often doesn't address folks' identity or other concerns, and they are more likely to have violent threats or violence committed against them when they are in those situations.